channel, Dr. Vlogger. So, as most of you know, I am a doctor, and yes, currently I am still working. I didn't stop working since the pandemic that started last March, although I mentioned on my previous vlog that I kinda stopped for a while, like more or less about 2 weeks. Kasi nung time na yon, bago lang yung pandemic, last March. And of course, I was really worried not only for myself, but also for my children and for my family, the yayas. And at that time, back then, we weren't really sure of how the virus is transmitted. We were still learning about it. And personally, I was still reading about it, doing my research, and when I was able to read about it and did my research and then asked some of my colleagues regarding what to do, and then dun sa hospitals, we have to wear a complete personal protective equipments like the coverall, the mask, the face shield, the goggles, and the gloves, foot cover, hair cover, yung mga ganon, before we go on making our rounds and also on duty. So when I was assured and I was kind of confident about what I knew regarding the pandemic, regarding COVID-19, I went back to work. And then, yun na nga, like what I said, I wanted to join in this fight kasi let's just face it, the primary warriors of this war is really the healthcare workers and the doctors, the nurses, and mga frontliners, and we are really needed, especially during this time. I made this video to just reiterate and to emphasize the importance of what is being said or advised to us by the Department of Health, and also by most of us, by most of the doctors and all of the healthcare workers. Personally ako, since March, since the start of this pandemic, I think I am doing something right because I'm praying I will still maintain or I will still continue to be COVID-free. At kasi may mga COVID positive na din talaga sa mga hospitals. I dealt with them. I even intubated some of them. And every time I did, palagi talagang natatakot ako, palagi iniisip ko yung family ko, ano na bang next step, do I still continue, is all of this worth it? And at the end of the day, I can actually answer na, yes, it's worth it because I love my job, I love my profession, and ito talaga yung oath namin, to really cure the sick or to serve the sick. I am very thankful for my family, for my kids. Sila lang talaga yung tipong yung parang hope and inspiration ko to really do my job. And then after my clinic or after my duty, I go home to them, and then kinakalimutan ko na yung trabaho, kinalimutan ko na yung toxicity sa hospital, and focus na ako sa kanila. So because of them as well, I really try so hard to protect myself. And how did I do this? How I protected myself for the past March, April, May, June, for the past more or less more than 4 months na po of this pandemic. These are just simple ways on how we can protect ourselves, and these are being shared by people from DOH, from WHO, from other agencies that are concerned with all of us. First of all is wear your mask. Wear your mask, and not just wear it, but wear it properly. It is known that COVID-19 is really transmitted by respiratory droplets, more or less 5 to 10 micrometer, and then mayroon pa ngayon naglalabasan, some epidemiologists say na airborne na din siya. However, that still remains to be investigated, and on the latest na release na article from Philippine Society for Microbiology and Infectious Disease, there are some studies that say that it is possible na airborne siya, but that remains to be proven pa. Meaning, kailangan pa siya i-investigate and kailangan pa siyang ma-proven through other studies. So as of now, let's stick to what is definite, which is wearing of the mask properly, and makakasave talaga siya. Just like what we've read, when you wear a mask, you reduce the transmission by 85%. So dito, as in kahit magchichikahan pa lang, kahit lalabas pa lang, lalabas ako, kahit sinasabi ko din sa yayas namin na paglalabas, mag-mask. Pinapakita ko din yan sa mga neighbors namin sa subdivision. Kasi, di ba, although I am very thankful na sa subdivision, I see all of them wearing their masks. We see a lot of this guidelines kahit sa Facebook, Instagram, or any other Viber groups na you should just wear your mask properly. Pero syempre, because I'm a doctor, I really usually wear the surgical masks, the N95 mask, KN95 masks, especially pag we're intubating a patient, or especially sa COVID ward. Sometimes we wear the KN95 mask and then over the surgical mask para at least mayroon pang face shield para super protected ka talaga. So yun yung pinaka number one, and I believe yun din yung pinupromote talaga ng DOH. Wear your mask. Kahit saan pa yan, it's really, hindi mo pwedeng sabihin na, wala pa kasi dito sa place namin na nagpa-positive. Like sa amin, sa subdivision namin, wala pang nagpa-positive. So malamang, kahit hindi naman ako mag-mask, kahit pupunta lang ako sa park, bibili lang ako sa tindahan, ganon. You cannot say that because it takes a habit para maging talagang everyday part of your life na siya. So you have to start na wearing the mask consistently, palagi, regularly, para parang part na siya. Kagaya na siya ng part ng, like ako, kagaya ng pag-wear ng eyeglasses, hindi na ako nakakalabas ng bahay o kahit nasa bahay naka-eyeglass ako because part na siya, habit na siya. So, yun, hindi pwede yung ganon so that hindi mo palaging nakakalimutan, you're always on your guard, kumbaga. So, ang second that I did, of course, yung social distancing, and it is really proven kasi respiratory droplet nga siya. So, pag may mask, tapos may social distancing pa, it reduces furthermore the transmission or the infectivity of the virus. Kasi pag may social distancing, they're promoting 1 meter distance. But better if it's more than that. If it's 2 meters, 3 meters, diba? Tapos magchichikahan lang. And then may mask ka pa. So talagang nag-i-increase. Mas lumalaki yung percentage na hindi ka mahahawa sa isang patient na positive. At pinaka main din lahat, as of now talaga, for me, that's why palagi ko siyang ginagawa, is iniisip ko lagi na yung makakasalubong kong tao, positive siya. Ayoko na siyang isipin na, hindi. Kasi parang hindi to may positive, negative lang to. Diba? Parang automatic na treat everyone as COVID positive. Especially now, na lumuwang-luwang na yung quarantine protocols or yung quarantine natin, nag-GCQ na, and then soon, diba? Baka mas maluwang na naman siya. So, anyway, i-treat mo na lahat kasi kami nafe-feel na po namin sa hospital as of now, and now is like July, nag-i-increase na naman yung mga COVID positive na patients. Kahit yung healthcare workers, dumadami na naman ulit sila. And in this specific hospital, mayroon na naman ding positive na nurse, may positive na mga ibang healthcare workers or other frontliners. So feel na namin na naging complacent na naman or naging kampante na naman yata yung mga tao. Kasi in all honesty, nung ECQ, parang so far, hindi na dumadami yung positive namin. Na-feel namin, okay. Parang naging relax din kasi hindi na nga madaming naging positive nung time na yun. Considering that naging loose na naman ulit ngayon, dumadami na naman siya. So yeah, first, wear the mask, social distancing. If you imagine, pag nag-cough or nag-sneeze yung tao, tas may mask ka and then social distance pa, pupunta lang sa may limit lang because you're wearing the mask yung virus, and if ever man lumabas man kung sobrang dami ng particles na yan, lumabas man yung iba dyan sa mask mo kasi if ever may cloth mask or whatever, nandyan lang yan, hindi siya pupunta, hindi siya makakahawa sa isang individual pa na makakasalubong mo. And then the third one is which is very common as well, is washing of the hands, or kahit man lang you bring alcohol with you and then sanitize your hands. It's also proven, nasa studies na din, na pwede din siya maging fomite transmission or yung mga transmission sa surfaces. And although I have read na hindi naman daw dumidikit sa clothing, but isipin mo lang na lahat ng surfaces na yan, para to be safe, na you sanitize, you hand wash, kasi yung hands natin, lahat, diba? Hindi naman pwedeng nakaganyan lang tayo. So, may mga times talaga na nakakahawak tayo. No? What if may viral particles doon, mahawak natin? And if ever mahawak natin, avoid touching your face, touching your mask. Diba? So, those are the things na dapat iniisip natin. Avoid touching them, and pag every time nakatouch ka and then nagduda ka, especially na wala ka sa bahay, like kami nasa hospital, palaging may alcohol sa bag ko, and then nagsasanitize. Then if ever, pag nakakita ako ng CR na may soap and water, better na mag soap and water. So yon. So actually, those top 3 things, those are the most and the proven na precautionary measures, na guidelines that will help for us not to be infected. And if we all do that, tayong lahat, di ba? Parang ano lang yun eh. Parang we protect ourselves and we also protect others. And since I am working in the hospital, one of the things that I am also careful about is the proper donning, meaning pagsuot ng PPE, the personal protective equipments, and the proper doffing of it, especially yung doffing. Kasi galing ka na sa COVID positive na patient nun eh. Perhaps I will make a separate video regarding that one. And it's also one way of me protecting myself. And also, pinaka main important points, and I've learned this from reading updates or articles regarding COVID-19 from official sites like the DOH, WHO, CDC. You protect your mouth, your nose, and your eyes. Men, M-E-N. So, you wear a mask, or you cover the nose and the mouth, then you wear the mask properly. And then, if may face shield ka, mag-face shield ka. And you remember always men, mouth, eyes, and nose. And lastly, and I believe yung the best and proven 100%, hindi lang 85, 75%, whatever, is prayer. Si God lang talaga, kahit ano pang protect mo sa sarili mo, if you're not really praying, I believe siya lang talaga yung magde-decide if you are going to be infected or not. If He sees that you exerted all efforts, and then perhaps, di ba, when you pray genuinely and sincerely, He will save you and He will save us. And with that being said, I am praying that He will really save us. He will save the world from this pandemic. And like you, like all of us, I am also waiting for that day na hindi na tayo magmamask, hindi na tayo magso-social distance, hindi na tayo yung palaging nag-alcohol, na naging dry na yung hands natin sa kaka-alcohol, sa kaka-hand wash. Although, of course, this pandemic also taught us na palaging maging malinis. So, kahit wala yatang COVID-19, we still have to do those things, yung hand washing especially. But you know what, I'm also looking forward to that day na makakapag-travel na tayo, na makakapag-chikahan without the mask and without social distancing. So, please let us all cooperate. Let us help each other to defeat this enemy. I just really want to share all of those things to you guys. And I know you've already read about them. You've already heard from people talking about those things, na guidelines, but I'm just here to reiterate and to emphasize the importance of those guidelines na sana gawin natin lagi, na make them a habit. Anyway, so ito ay isang episode ulit ng mga doctor series that I did more than a year ago. As a doctor, I feel I have the responsibility to share what I know, and also this is not something na para mag-lecture to you guys. I'm just doing what I can to help. Hope you guys learn something about this vlog, or even if you already learned from them, at least it will be a reminder for you guys to make this a habit. So see you on my next vlog. Bye bye.